So, good morning, fans. Today I'm going to do something different. I'm going to show you how we prepare for an emergency CS, how to set the things as we wait for the surgeon to come so that the procedure can take place. So, below me is my suction machine. I'm ensured it's working. It's in a good working condition. I can test it. It's working. So I go next. These are the gowns for wearing before you go into the procedure. They are ready and available. These are the head caps and the masks for anybody assessing theater or the participants of the procedure. As you go, we go. These are the Raytech gauze packs which will be used for the procedure. We have the clean gloves, have the sterile gloves which the surgeon will wear. Then we have the drapes. These are the one which the patient, they are sterile in nature, so the patient will be these drapes will be put over the patient for sterility purposes. This is the abdominal pack which will be used for the procedure. Again, we go. This is the major CS set. It's a major set, so it's a CS set which will be used again for the procedure. I don't want to open it because we may spoil the sterility of the procedure. As we go, these are the maternity pads which will be used by the patient. I have my extra items on that. I have my ordering book. This is the baby receiver code. It's on. Just testing it before I switch it off. These are the tools which will be used. This is the drug tetracycline which will be placed on the patient eyes. These are surgical sterile gloves which will be used to handle the baby. This is the pink ID band which will be used for the baby again. We have two. This is the ambi bag in case of anything. You see the baby coat. The receiver has the temperature regulator. It's very warm. These are the cord clamps as we wait for the procedure. Cord clamp, suction catheter, nurse oxygen cannula for the baby. We have the suction catheter, very small, two cord clamps. Again, the ID band for the baby. We go. This is the board for writing. The items we'll be using, cutting time, timeout. The gauze count will be done here and the type of instruments to be used. We go. That is the anesthetist machine. I've also set the anesthetist items. As you can see, we have several syringes, water for injection, and needles, as well as clean gloves and a suction tube which will be used for the procedure. The rest, they are the endoscopy machines, so we're not using them today. So we have the anesthetist machine, we have the monitor, Mindray monitor, which will be used. We have the coagulator in case it's needed, but I don't think we'll use it for the procedure. We're not going to use it. That's our tray, emergency tray, with the file and a few bottles for the specimens. We have then we have the lightings for the theater procedure. We're going to use those lights. You see, they're very sharp. So our tour ends there.